This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning. It's great to be back after all this time. And Jill, good morning. How are you? It's different seeing you over there, not Ken.
I know. I'm good, thanks. Intrigued to hear what you've got to say about acupuncture and back pain.
And back pain, yeah. Well, apparently you've been talking to other people behind our back, questioning whether acupuncture actually helps with back pain. Can you believe that, Grant, that she actually thinks it may not help?
Oh, no, that's, let me disabuse you of that notion. It does help.
Yeah, that's what I'm here for. You guys can persuade me.
Yeah. So, but before we start talking, Grant, now you've got I'm quite mixed up about you because I always thought you had a bit of an American accent, so I concluded you were from America, but then you lived in China for many years, and then you're practicing in Hamilton, so... Yeah, just give us a bit of a background, like who you are and what you did.
Yeah, well, my background is in psych and rehab.
Okay.
That's what I first studied in university. I lived in America for 13 years, and
but you were born here?
Yeah, born in lovely Hamilton,
right?
With the soggy weather.
Yeah.
It's not like the Hawke's Bay. And so I stayed over there, and then I switched over to Chinese medicine, and I went to a university there in Los Angeles, and after 5 years graduated, took the state boards, and became a California acupuncturist.
Right. Now, but you went to China too?
China. And I spent 4 years there.
Right, okay. Fantastic.
Yeah, and so I did, out of those 4 years, probably 3 years, postgraduate internship, postgraduate studies.
Yep. Fantastic.
Clinical studies.
And then back to Hamilton.
And then back to Hamilton, and I love it here. I've lived in big cities all of my adult life, and I love it back here. Just
Fantastic.
The right size.
Right. Now, and then also you're probably the envy of many of us other Western acupuncturists here in New Zealand because you're quite fluent in Chinese. And now that Hamilton has a reasonably high Chinese population, are you getting many Chinese patients?
Actually, no.
Right.
Maybe one every 3 months.
Oh, right. Okay.
Now my Mandarin used to be very good, but after all these years home, it has slipped.
Right.
It's slipped, but I can still order off Chinese medicine, Chinese menus at the restaurant.
Right. Well, that's the most important thing. Now, we're going to be talking today about back pain, and also that would include sciatica and hip pain and back spasms and upper back pain and whatever. Now, you've had a lot of experience treating acute and chronic back pain. What sort of percentage would you say your patients are coming in the clinic with back pain? Is it like a lot of them, 50% or whatever?
Oh, at least 50%.
Yeah.
At least 50% of the patients who come here come with back pain.
Now, did you hear that, Jill? 50% of his patients.
I did hear that.
Those 50%, of the 50%, nearly all of them walk out satisfied customers.
Yeah, that's right. Now, that's what we want to hear, Grant. We know that. Now, I presume a lot of them are ACC-based clients, or and have they done other stuff? I don't know, massage, physio, or Pilates, and drug therapy, or are they coming to you through the doctor or word of mouth? How are they coming to you?
About of the 50% that come here, half of them are probably word of mouth.
Yeah.
And then I get referrals from local GPs, and a few physios, not many, but a few physios send me patients with the back pain, both chronic and acute. So because I don't advertise, so it's somehow they come, and it's usually word of mouth. Yeah,
I've noticed that you don't advertise because it was very hard for me to actually find your phone number. Because everybody else has
not very technological when it comes to that sort of thing.
Everybody else has 18 websites. I was just going to say, everybody else and has 18 websites and Facebook pages and LinkedIn profiles and, but with you, it was like I had to actually go to the Acupuncture Association to find out where you were.
Yeah, I'm hard to find.
Yeah.
So my business card is my number one advertising agent.
Right, okay.
Yeah.
Now listen, as we know, Chinese medicine involves a number of, different modalities, and acupuncture / putting in the needles is one little part of it, and we have cupping, we have moxibustion, we have tuina / massage, we have gua shu, and we know we have more modern approaches like electroacupuncture. In your approach to the treatment, are you using any of these other modalities, or is it a case-by-case basis?
Well, it's a little bit prescriptive, like everyone nearly gets the same treatment. Yeah. But the one thing that I have dropped off completely is electroacupuncture stimulation.
Right, okay.
I no longer do that anymore. I just don't feel it works. And if the outcomes are exactly the same, so why employ that method when I'm not satisfied with the outcomes?
Right, okay.
Yeah, so I do primarily for back pain. I test them out if it's sciatica, straight leg lift, that sort of thing. Then I get straight into the business, which is I do local needling all through the back, paraspinally. Even there's a special point on the fifth lumbar vertebrae below that one. I do the needling, and then I do with infrared heat. I always have heat. Chinese medicine, cold does not rate very highly.
Now, what about the moxa? Are you using any moxa?
I use moxa. Yep. I do both needle moxa, and I use Kane Monrad's Dr. Moxa.
Yeah.
Yeah, that's stick-on moxa, a little bit modern application. And then I do cupping. Everyone gets cupping.
Right.
For back pain. And then after, and I'll rub some nice balm, and if it's really bad, I'll stick on some Chinese pain plasters. Just to cover overnight to make sure they're comfortable. And then at the end of that lying down treatment, I take out needles, cups and everything, and I have them sit out the front in a chair, propped up, and I do some Master Dong's points for back pain.
Tell us a bit about Tell us a bit about firstly the Master Tung style, like
Well, it comes from Eastern China.
Yeah.
It's about 2,600 years old, and generally the points are not local points. Like, I think 99% of the points are not local points. They're all a little strange, and they all occur on the hands and arms and legs and feet, a few on the torso, but the points I use are all on the hands, opposite side of the pain, if they do have sciatica. And then, I just have them move. They have to stand and move with the needles in place. So it's obviously not in their legs or feet.
Yeah.
And they have to walk, and then they sit back down, and I do that 3 or 4 times, and then I let them go home.
Right, okay.
And one thing that tells why I do that is that it satisfies the patient that the pain is down and they're going to get through the night. That's the main reason. And then the other thing is that, according to Chinese medicine, sometimes we have to do movements to ensure that the treatment is working.
Yep, just to get the qi and the blood moving after you've
exactly.
activated them. Yeah. Now, and I presume the back pain treatments are similar for sciatica treatments. Like you might put a point, I don't know, between the 3rd and 4th finger on the left hand or something to treat the sciatica.
Or 4th and 5th.
Yeah.
4th and 5th finger.
I just guessed that, so I was close.
Yeah. So that's Yao Tong Xue. That's the traditional point for lower back pain. Yeah. But Master Dong has a sciatica points, that lingu dabai combination, just by the thumb and index finger, and it works well every time. And in the case of really severe pain, I put a needle right on top of the head at the 100 meeting.
Well, that's got Jill excited. A needle on top of the head. She's shaking her head in disbelief at the moment. So.
Well, I have non-believers who are in such pain, and the treatment doesn't seem to be working thus far, and I stick that needle in, and nearly every time it takes away pain from the lower back.
Yeah. All right, look, we're just getting a little bit short on the timing, so we'll need to finish up. And then, sorry, because I thought you were from America, so then I picked a sort of an American song. I picked a song by Jimi Hendrix called "The Star Spangled Banner." So we'll still play that in your honour of your time when you were there, Grant. So.
Yeah, I love Jimi Hendrix.
All right, and we're going to have you on the show again in not long after this, and then we'll be talking about pregnancy. So we look forward to that, Grant. So thanks very much for coming on to the show.
Well, thanks for having me.
Okay, all the best. Cheers.
All right, bye-bye.